Hello, hi, it's Hema here. I'm taking this video on my way back home from my work. This video is regarding an important question: how we have to deal with a patient with learning disability in CSA. It's very important to practice this case because in day-to-day life we may come across similar scenario. For example, when I was a GP registrar, I was covering the residential home and nursing home, and we had a patient with multiple sclerosis at the time, and he was only 30, and he opted not to have any resuscitation and even not to have any paracetamol for his pain. And the staff nurses were very worried, and they were like asking me, like, "Doctor, can we give through his Venflon even without he noticing?" And they were really worried that they're not helping the patient in terms of the pain control. So it was a bit dilemma for me because we have to make sure how competent the patients are to make a decision, and we have to follow the patient's autonomy, and we should always support patients' point of view if they are mentally competent. So I made sure to have a thorough discussion with him, and he understands the pros and cons of his decision and the risks involved, and he was really very mentally competent to make the decision, and he understands the pros and cons, and following that he can make a decision. So there I supported my patient at the time, and then I told the staff nurses there, like, we have to appreciate his wishes and go with that. And finally they agreed with the plan not to give any Calpol, paracetamol or anything to the patient according to the patient's wish, right? So in CSA we have only 10 minutes, so I would like you to get the rapport first quicker. I would usually try and use the first name of the patient and clarify like how much they are affected by the disease process, whether it is Down syndrome or whether it is cerebral palsy. There are various severities, isn't it? Just to make sure whether they are competent or incompetent and how far they are dependent on others for their daily activities. So make sure whether they are competent or not, first of all, and gather more information from the patient and whoever accompanying the patient, like, for example, family member or the caretaker or other staff member from the residential home. And just gather more information from them and make sure to address the concerns from both the parties, and try to involve the patient, the staff, and the patient like a team. Get more information and talk to the patient, ask what they feel, what they think about it, what they understand about it, and can they retain our details, our information, and can they take decision on that. So it's very important to be flexible and patient. I know in CSA we will be thinking, oh my God, my time is running out. Wow, what this patient is doing? You might be thinking like that, but I think slow and steady wins the race in this case. So first point, make sure how competent they are, and second point, gather enough information not only from the patient but also from the carers, and arrange an accurate, appropriate follow-up plan to meet the family and staff member, like a team plan. You can even organize some day where other paramedical staff or other like for example occupational therapist or physiotherapist, according to the need, you can arrange a care plan for them and a meeting for them so that you can take a decision on that. So learning disability case is not a difficult case, provided you take it easy and go with open-minded, and try to truly help the patient and the carer involved or the family members involved, because it is our duty of care to offer as like a holistic care, isn't it? As a GP, we have to look into each and everything, like whether they have any financial problem, whether they need any other colleagues' input, like for example, occupational therapy or physiotherapy, and we have to think about the home situation, the safety, and who else we can contact to make the patient safe. So these are all very important points you have to cover within 10 minutes in CSA, and go with the flow, and be genuine, be authentic, try to give the best care as possible, and accept your limitation as well. In case if you don't know anything, just tell them that I would get the enough information and get back to you, something like that, and wrap up with a appropriate management plan or follow-up plan. And if you have any concern about the patient safety, or vulnerable adults, or kids, please make sure to address that then and there, and tell them that you're going to involve so and so people, and the seriousness of the problem, and highlight it. That's it. So take by each case separately. Don't guess the agenda or guess the case, and I think you'll be fine. See you in a next free video series. Bye bye.